Today we're diving into a very important topic that affects so many of us, especially as we age: muscle loss. Now, you've probably heard of the many things that happen to our bodies as we get older. We might notice our skin changing, our energy levels declining, and for many of us, the muscle mass slowly slipping away. But the good news? We have tools at our disposal to fight back and preserve our strength. And one simple, incredibly effective tool I want to talk about today is a vitamin that, when taken consistently, can help prevent muscle loss and keep you feeling strong. Before we dive into the how and why, let's understand the problem first. Muscle mass naturally begins to decline as we age, a condition called sarcopenia. This doesn't happen overnight, but over the years, our muscles lose their size, strength, and endurance. And this doesn't just make us weaker, it affects our mobility, our balance, and ultimately our independence. As we age, our bodies undergo numerous changes, many of which are inevitable. One of the most significant changes is the gradual loss of muscle mass, a condition known as sarcopenia. Sarcopenia refers to the natural and progressive decline in muscle mass, strength, and function, which occurs as part of the aging process. This condition begins subtly, often without obvious symptoms, and worsens over time, eventually impacting a person's ability to perform everyday tasks and maintain independence. While some degree of muscle loss is expected as we age, the rate and extent of this decline can vary depending on factors such as genetics, lifestyle, and nutrition. The loss of muscle mass can lead to a number of serious consequences, not only affecting strength, but also mobility, balance, and posture. As muscles shrink and become weaker, seniors may experience difficulties in performing activities that were once routine, such as walking, climbing stairs, or even getting out of bed. The resulting loss of physical function increases the risk of falls, fractures, and other injuries, which can have long-lasting effects on health and quality of life. Beyond the physical limitations, muscle loss can also have psychological consequences, contributing to feelings of frustration, depression, and a loss of confidence in one's ability to live independently. The underlying cause of sarcopenia is multifactorial. One of the primary factors is the decrease in the body's ability to synthesize protein and build new muscle tissue. As we get older, the body's production of certain hormones, such as testosterone and growth hormone, declines. These hormones play an important role in muscle repair and regeneration, and their decrease significantly impacts the body's ability to maintain or grow muscle mass. Additionally, the efficiency of muscle fibers diminishes with age, making it harder to engage in activities that require strength or endurance. Another factor contributing to sarcopenia is the reduction in physical activity levels that typically occurs with aging. Many older adults become less active due to various reasons, including joint pain, fatigue, and a general decrease in motivation. The lack of regular physical activity, especially weight-bearing exercises, accelerates muscle loss. When muscles are not regularly challenged, they begin to atrophy, weakening the muscle fibers and leading to further loss of muscle mass. Furthermore, the nutritional intake of older adults may not meet the demands required to maintain muscle health. Protein intake, which is critical for muscle repair and growth, tends to decrease with age, and some seniors may have difficulty absorbing nutrients due to changes in the digestive system. Moreover, sarcopenia is often exacerbated by other age-related conditions, such as chronic diseases, poor diet, and inactivity. Conditions like osteoarthritis, diabetes, and cardiovascular disease can contribute to muscle wasting and reduce a person's ability to maintain an active lifestyle. The interplay of these factors creates a vicious cycle where muscle loss leads to a decline in physical activity, which in turn accelerates further muscle wasting. Despite the challenges posed by sarcopenia, it is important to understand that muscle loss is not an inevitable fate for everyone as they age. With the right interventions, such as proper nutrition, physical activity, and appropriate supplementation, it is possible to slow or even reverse the effects of muscle loss. Vitamin D is often associated with bone health, but its role in muscle function is just as critical, especially as we age. This fat-soluble vitamin is essential for the proper absorption of calcium and phosphate, two minerals that are integral to bone health. However, it also plays a direct role in muscle strength and performance. Vitamin D influences muscle tissue at the cellular level by regulating calcium levels within muscle fibers. Without adequate vitamin D, muscle fibers cannot function properly, leading to reduced muscle strength and an increased risk of weakness and atrophy. The body produces vitamin D naturally when the skin is exposed to sunlight, but as we age, our ability to synthesize vitamin D from sunlight decreases. This makes older adults particularly vulnerable to deficiencies, especially in regions with limited sunlight or during the winter months. Additionally, certain lifestyle factors, such as spending most of the time indoors, wearing sunscreen, or having darker skin can further reduce the body's ability to produce vitamin D. For many older adults, the body's natural synthesis of vitamin D from sunlight is insufficient, and supplementation or dietary intake becomes necessary to maintain optimal levels. Vitamin D's influence on muscle function is not just limited to its role in calcium regulation. It also has a direct effect on muscle cells by enhancing the process of muscle contraction. The vitamin binds to vitamin D receptors found in muscle cells, which plays a significant role in muscle strength and contraction. This process is essential for maintaining muscle performance and coordination, both of which are key to mobility and balance. Low levels of vitamin D can impair muscle function, making movements slower, more difficult, and more prone to error. This results in the gradual weakening of muscles over time, which can have a significant impact on overall mobility. Research has shown a clear link between vitamin D deficiency and muscle weakness. In fact, numerous studies have demonstrated that individuals with low vitamin D levels are more likely to experience muscle weakness, reduced grip strength, and an increased risk of falls. For older adults, muscle weakness is not just a matter of physical strength, it is a risk factor for more serious health complications, including falls and fractures. These injuries in turn can lead to long-term consequences such as disability, hospitalization, and decreased quality of life. In addition to muscle strength, vitamin D also supports the health of the neuromuscular system, which is responsible for controlling muscle movement. By maintaining optimal vitamin D levels, the nervous system functions more efficiently, leading to better coordination and reaction times. As we age, the nervous system naturally becomes less responsive, but ensuring adequate vitamin D levels can help mitigate this decline. For seniors, the ability to react quickly and maintain coordination is crucial for preventing falls and maintaining independence. Given its far-reaching impact on muscle and overall health, ensuring adequate vitamin D levels is crucial, particularly for older adults. Supplements are often recommended to help fill the gap left by inadequate sun exposure or dietary intake. However, it is important to note that vitamin D works best when consumed alongside other key nutrients like magnesium and calcium, which support its absorption and utilization in the body. By maintaining proper vitamin D levels, seniors can significantly enhance their muscle function, reduce their risk of weakness, and maintain greater overall health and mobility. Vitamin D deficiency is a common problem among older adults, and it can have serious consequences for muscle health. The link between low levels of vitamin D and muscle weakness is well established in scientific literature. As vitamin D plays a pivotal role in calcium absorption, it directly affects muscle function. Calcium is essential for muscle contraction, and without sufficient vitamin D to facilitate its absorption, muscles become less responsive and weaker. This can lead to a gradual decline in muscle strength, making it more difficult for seniors to perform daily activities. One of the primary reasons why vitamin D deficiency is so prevalent in older adults is due to the changes that occur in the skin's ability to produce vitamin D from sunlight exposure. As people age, the skin's capacity to synthesize vitamin D from UV rays diminishes, which means that older adults are less able to get adequate amounts of this crucial nutrient from sunlight alone. This is especially problematic in regions where sunlight exposure is limited for part of the year, or for those who spend most of their time indoors. Furthermore, factors such as using sunscreen, which blocks UV radiation, and having darker skin which contains more melanin that reduces the skin's ability to absorb UV rays, further exacerbate the risk of deficiency. In addition to the reduced ability to produce vitamin D from sunlight, older adults may have difficulty absorbing vitamin D from food. The digestive system tends to become less efficient with age, which can lead to poor absorption of nutrients including vitamin D. Furthermore, certain medications commonly prescribed to older adults, such as corticosteroids and anticonvulsants, can interfere with vitamin D metabolism, increasing the likelihood of deficiency. As a result, many seniors are unable to meet the daily vitamin D requirements through diet or sunlight alone, making supplementation a critical part of their health strategy. The consequences of vitamin D deficiency extend far beyond just muscle weakness. Low vitamin D levels can lead to a condition called osteomalacia, which is characterized by softening of the bones, as well as an increased risk of osteoporosis. Osteoporosis is a condition where bones become fragile and brittle, leading to an increased risk of fractures. This makes falls, a common concern for seniors, more dangerous and increases the likelihood of long-term disability. The weakened muscles that result from vitamin D deficiency contribute to poor balance and coordination, which significantly raises the risk of falling. Moreover, research has shown that people with low vitamin D levels are more likely to experience fatigue, depression, and an overall decline in physical performance. This is because vitamin D has a broader impact on the body than just muscle and bone health. It also plays a role in immune function, mood regulation, and even cognitive health. For seniors, maintaining adequate vitamin D levels is not just about protecting muscle strength, it's also about improving overall well-being. In light of all these factors, addressing vitamin D deficiency is crucial for seniors. Regular blood tests can help identify whether someone has low vitamin D levels, and supplementation can be prescribed to bring those levels back into a healthy range. It's also essential to combine supplementation with a well-balanced diet, proper sunlight exposure, and physical activity to support optimal muscle function and overall health. By addressing vitamin D deficiency, seniors can reduce the risk of muscle weakness, improve mobility, and maintain a higher quality of life. Consistent vitamin D supplementation has been shown to produce measurable improvements in muscle strength, especially when taken regularly over a period of time. For older adults who may struggle with muscle loss due to aging or inactivity, incorporating vitamin D into their daily routine can be a simple but highly effective intervention. Research has demonstrated that vitamin D supplementation can increase muscle strength, reduce weakness, and improve overall physical performance, sometimes in as little as 2 weeks. This relatively quick effect is especially important for seniors who may feel the impacts of muscle loss more acutely and need to see tangible results to stay motivated. One of the key ways that vitamin D works to enhance muscle function is by improving calcium absorption. Calcium is vital for muscle contraction, and when the body is not getting enough of this mineral, muscles become less responsive and weaker. Since vitamin D helps the body absorb calcium from the food we eat and from supplements, ensuring adequate vitamin D levels is crucial for maintaining muscle strength and preventing muscle wasting. When vitamin D is insufficient, the body's ability to retain and use calcium is compromised, leading to a decrease in muscle function and overall weakness. Furthermore, vitamin D also plays a direct role in the growth and repair of muscle tissue. As muscles are used throughout the day, they undergo cycles of wear and repair. This process is crucial for maintaining and building muscle mass. When vitamin D levels are optimal, the body is better equipped to repair and regenerate muscle tissue after physical activity. On the other hand, when vitamin D levels are low, this repair process is slower and less effective, contributing to the gradual loss of muscle mass and strength. By providing the body with sufficient vitamin D, older adults can support the natural muscle repair processes that occur, helping to prevent further muscle loss and maintain strength. In addition to improving muscle strength, vitamin D supplementation can also enhance balance and coordination. These are vital components of overall physical function, especially for seniors who may be concerned about falls and maintaining their independence. Research has shown that seniors with adequate vitamin D levels tend to have better balance and are less likely to experience falls compared to those with deficient levels. By improving muscle function and coordination, vitamin D helps reduce the risk of falls, a leading cause of injury and hospitalization among older adults. The benefits of vitamin D supplementation are most apparent when the vitamin is taken consistently. While occasional doses may provide some relief, it is regular supplementation that leads to lasting improvements. Many experts recommend a daily dose of vitamin D, typically between 1,000 and 2,000 IU for older adults, although individual needs may vary based on factors such as existing vitamin D levels, dietary habits, and overall health. Taking the vitamin with a meal that contains fats can enhance absorption, as vitamin D is a fat-soluble vitamin. By establishing a daily routine that includes vitamin D supplementation, older adults can support their muscle health and reduce the risk of further muscle loss. The positive effects of vitamin D on muscle strength, balance, and overall physical performance make it a critical part of any aging individual's health strategy. By taking vitamin D consistently, seniors can not only combat muscle loss, but also improve their quality of life, maintain independence, and enjoy greater mobility in their daily activities. Vitamin D supplementation is most effective when combined with a healthy diet and regular physical activity. While taking vitamin D supplements can help correct deficiencies and improve muscle health, the full benefits are realized when it is part of a broader strategy that includes proper nutrition and exercise. These factors work synergistically to support muscle strength, mobility, and overall well-being, particularly in older adults who may be at a higher risk for muscle loss and frailty. A balanced diet that provides adequate protein, healthy fats, and other essential vitamins and minerals is crucial for maintaining muscle health. Protein, in particular, is a key building block for muscle tissue and plays a direct role in muscle repair and growth. Seniors may find it more challenging to consume enough protein due to changes in appetite, chewing difficulties, or digestive issues, but ensuring that they get enough protein is vital for maintaining muscle mass. Foods such as lean meats, fish, eggs, legumes, and dairy products are excellent sources of protein that can complement the benefits of vitamin D supplementation. Healthy fats are also important for muscle function and overall health. Since vitamin D is a fat-soluble vitamin, consuming it with meals that contain healthy fats can enhance its absorption. Foods like avocados, olive oil, nuts, seeds, and fatty fish not only help with the absorption of vitamin D, but also support overall heart and brain health. Incorporating these types of foods into a senior's diet can provide additional benefits beyond muscle health, supporting their overall vitality and well-being. In addition to proper nutrition, physical activity is one of the most effective ways to combat muscle loss and maintain strength as we age. Exercise, particularly strength training and weight-bearing activities, stimulates muscle growth and helps preserve muscle mass. For older adults, even moderate physical activity can have a significant impact on muscle strength and function. Activities like walking, resistance training, and yoga help improve flexibility, coordination, and balance, all of which are essential for maintaining mobility and reducing the risk of falls. Strength training exercises, such as lifting weights or using resistance bands, are particularly beneficial for stimulating muscle growth and improving muscle tone. The benefits of combining vitamin D supplementation with physical activity are well documented in scientific research. Studies have shown that seniors who engage in regular exercise and take vitamin D supplements experience greater improvements in muscle strength and mobility compared to those who rely on supplements alone. Exercise not only helps build and preserve muscle mass, but it also supports bone health, cardiovascular health, and mental well-being. This combination of proper nutrition, exercise, and vitamin D supplementation creates a comprehensive approach to aging healthily and maintaining independence. It is also important to note that regular physical activity can help address the potential side effects of vitamin D supplementation, such as the risk of excess calcium buildup in the body. Exercise helps maintain a balance of calcium levels and ensures that calcium is used effectively by the muscles and bones. For seniors, this is particularly important because excessive calcium without proper physical activity could lead to complications such as kidney stones or vascular calcification. By integrating vitamin D supplementation with a nutrient-rich diet and regular physical activity, seniors can create a holistic approach to preserving muscle health, enhancing mobility, and improving overall quality of life. This well-rounded strategy is essential for maintaining strength, preventing falls, and supporting long-term health and independence. Maintaining optimal vitamin D levels can have a profound impact on muscle function and overall health, particularly for seniors. When combined with consistent supplementation, proper nutrition, and physical activity, vitamin D has the potential to reduce muscle weakness, enhance strength, and improve balance, which are all essential for seniors to maintain their independence and quality of life. One of the most beneficial aspects of vitamin D supplementation is that it is a simple, cost-effective strategy that can yield noticeable improvements in as little as 14 days. By addressing vitamin D deficiency early, seniors can see meaningful gains in their muscle health, which can help prevent the progressive effects of muscle loss that come with aging. Vitamin D plays a crucial role in regulating calcium and phosphate levels, which are necessary for muscle contraction and overall function. When vitamin D levels are low, the body's ability to absorb calcium from food diminishes, impairing muscle function and leading to weakness. This makes the regular intake of vitamin D essential for maintaining proper muscle health, particularly in seniors who may be at higher risk for deficiencies due to limited sun exposure, dietary factors, or the natural decline in the body's ability to synthesize vitamin D as we age. For seniors, consistent vitamin D supplementation can also help mitigate the increased risk of falls and fractures as muscle strength declines with age, balance and coordination suffer, making falls a significant concern. Vitamin D has been shown to improve muscle strength, particularly in the lower body, which directly supports better balance and a reduced risk of falls. This is critical for seniors as falls can lead to serious injuries, reduced mobility, and a decline in independence. Regular vitamin D supplementation can be a powerful tool in improving muscle function and enhancing coordination, allowing seniors to move with greater confidence and stability. Another important factor to consider is that maintaining optimal vitamin D levels can enhance overall physical performance. For seniors, even modest improvements in muscle strength can have a meaningful impact on their ability to perform daily tasks, such as walking, carrying groceries, or getting in and out of bed. These seemingly small tasks contribute greatly to one's independence, and being able to perform them without strain can have a positive effect on mental and emotional well-being. Vitamin D's role in improving muscle function can help seniors lead more active and fulfilling lives by enhancing their ability to engage in physical activities that they might have otherwise struggled with. Moreover, the benefits of vitamin D extend beyond just muscle function. Vitamin D plays an essential role in overall health, including immune function, cognitive health, and mood regulation. As we age, maintaining a strong immune system and staying mentally sharp become increasingly important. Vitamin D's ability to support the immune system helps seniors fight off infections, reduce inflammation, and maintain general health. Additionally, there is growing evidence suggesting that vitamin D deficiency is linked to mood disorders such as depression and anxiety, conditions that are common among older adults. By ensuring adequate vitamin D levels, seniors may experience improvements in both mental and emotional health, further enhancing their quality of life. Given the broad range of benefits that vitamin D provides, it is clear that supplementation is an effective way for seniors to support their muscle health, mobility, and overall well-being. When combined with a healthy diet and regular physical activity, the positive effects of vitamin D become even more pronounced, creating a comprehensive approach to aging that emphasizes strength, independence, and vitality.